I want to leave time for some questions. So if anyone has any questions for any of us, I'll take those now. Pat?
I wanted to ask Pam, you said skilled nursing, we can become an actual body. I thought we couldn't do that. We can?
Yes, long-term care providers can. I think the issue with CCRCs is that many states prohibit outside admissions. So it's challenging because, right, so it's challenging to be part of the continuum, but I think that Sue just used some excellent programs that you could somehow develop a relationship with an ACO and say, this is how we would keep people.
You could have an ownership piece?
You could, yeah, you could also become a member.
Questions? Yes, sir.
The several states that are bowing out of the Affordable Care Act, how do you feel, and I guess it's how's that going to affect the Affordable Care Act?
Well, it's interesting because I've heard that it's a lot, I mean, there are just two provisions, the voluntary provisions, the Medicaid expansion and the state insurance exchange. And the Act does provide for a federal default exchange, but as I understand it, the details of that have not been worked out. So what I've heard is that the states are really using this as an opportunity to get the government talking and changing some of the things that they don't like about the Act. So there may be movement on what, maybe, I mean, who knows, it may be moot in September, in November, I'm not sure, but I don't think, those are just two provisions right now that the states are pushing back on and saying that they're not going to participate in.
Yes, sir.
Pamela, to participate in an ACO, a provider agreement, since you probably have memorized the Act, would the provider have to be duly certified for both Medicare and Medicaid in order to participate? Do you recall any language to that extent?
I did not memorize the Act, but it is like 1,000 pages. And one of the most poorly written pieces of legislation, I think the best analogy I ever heard was that it was like making sausage, and it was all snout and ears. The regulations since then have been really good at clarifying, but I'm going to tell you what I think, but I would not think you would have to be a Medicaid certified provider. I think that really what is relevant for ACO is the Medicare, because it only relates to Medicare fee-for-service reimbursement.
Questions?
My question is, I might have it wrong, but the issue that was taken before the court was Commerce Clause mandate. And then the court said, no, you didn't mean that. You really meant whether or not it was a tax. So they redefined on the fly what was initially put to them.
Well,
am I saying that right?
I understand the question, but the government had many positions. They thought the strongest was the Commerce Clause, that the mandate would be upheld as constitutional, but they also presented the taxing power.
So 2 issues were put before the court, right?
Well, the 2 issues were whether the individual mandate was constitutional and whether the Medicaid expansion was constitutional. But, lawyers, we like to hedge our bets. So for each of those issues, there were numerous positions of why it should be constitutional. The government had many different arguments, at least.
What was the court asked to deliberate?
It was the individual mandate and the Medicaid expansion, those 2 programs, part of the Affordable Care Act, were those constitutional? And if they were not constitutional, could the Act be severed and other provisions still stand, or did we have to strike down the entire Act?
I'm still confused.
Oh, I'm sorry. No, well, please, you know what? I'd be delighted to talk to you. When I leave, I'll give you my card.
Ross? I think it probably will be, yes. I think we'll have to look at, though, some of the things like the decision support software, utilizing electronic records, but as we retain a more acute resident in our communities, yes, I think it will. Yes, sir.
Gary, do you see the ACOs and the hospital organizations such as yours truly bringing us in as partners in that part of the ownership of some of these ACOs, or are we still going to kind of be the stepchild position in the hospitals that kind of learn it all and kind of do what they say?
Yeah, that's a great question. So where we are with ACOs is really medical home models that we're doing with Cigna, United, and now looking at some fairly innovative reimbursement alignment with Blue Cross. So all of our focus has been primary care and a little bit of inpatient care. I would envision, though, the potential to bring in CCRCs and post-acute care as true partners as we get further down the continuum. And looking at how we reshape the overall finances and reimbursement realignment with this.
And I think this is an opportunity for CCRCs to start thinking and take a proactive approach in introducing themselves to hospitals that they already have relationships with in this context. And I think we have to create, the hospitals, they may not come to us long-term care. With the readmission issues, I think long-term care has become more relevant for acute care providers, but this is really the time for us to step up and think, what can we offer and how do we get involved?
Are there any opportunities, are there any opportunities for CCRCs in post-CON states participated in ACO?
Well, I had really thought that there probably were not, because you cannot accept outside admissions, but I think Sue did a terrific job at showing these different programs that CCRCs offer, and maybe it's not admissions, but there are other relationships and other things, services you can provide, and relationships with acute care providers. There are things to offer, and I think we should really sit down. That's what we should be doing before this meeting next year, and figuring out, there are 154 ACOs now, so they're just starting, and it's a an interesting process, so I'd like to see where we're going to take this.
Yes, sir.
Yeah, thank you.
One of the challenges that I think for ACOs or health systems are going to have, and that is, coming in the front door is going to be the capitation payment, the ACO type payment. The challenge is going to be defining, measuring, and allocating risk and payments within the system, within the partners. If you could expand on that.
Yeah, well, that is going to be a huge challenge. I mean, it's a food fight right now, just dealing with the inpatient environment and the physicians. So expanding that to post-acute and CCRC is going to be a real challenge. I mean, what we continue to look for are models, organizations that have already done it. We haven't found any. I mean, if you all know of any that are really beginning to dabble into the distribution of the overall reimbursement through the continuum, we'd love to hear about it. We've asked United and Cigna, the two biggest players in the market, what their thoughts are about that, and frankly, they don't have any. So it's going to be a real challenge. We're going to have to figure it out. Like a lot of reform efforts, it's going to be region by region, and it's going to be a lot of experiment. And that's the real, to me, reason to have as a priority this collaboration and mindset of transparency. We got to share a lot of data. We got to understand more about your business. You need to understand ours. And through that, I hope we can come up with some models that are fair for everybody, make sense for everybody.
You just triggered something. When I talked about the compliance waivers, one thing that wasn't discussed was HIPAA. And it's one thing when you're fully integrated and running as an ACO, but in the initial stages, it's interesting. It can be worked out, but obviously you have to think about HIPAA and state confidentiality laws and the sharing of information.
Yeah, that's been the biggest challenge for our allowing access to our patient record is HIPAA. And we have worked through that with our attorneys. It's a lot of contractual work, but it can be done. And we're happy to share that if anybody's interested.
All right, we're getting flash the time's up sign, so thank you all.
Thank you.